welcome to the panel on prevention. As people are joining us, I thought we could just take a minute to give some introductions. So I'm thrilled to be joined here with Lucy McCrae and Veerawit, and we are all representatives of the Freedom Story, which is a trafficking prevention organization that's about 13 years old, based in northern Thailand in Chiang Rai, as well as in the non-province of Thailand. And we are so grateful that you're here with us today. We obviously care a lot about prevention and have thought and done this work for a very long time, and are looking forward to answering any questions as well as learning from you as well. So I thought I would just go ahead and get started with sharing a little bit about myself, and then I'll turn it over to Lucy and Veerawit to do the same. So like I mentioned, my name is Rachel. I'm coming to you from Oakland, California, which is where I call home. I co-founded the Freedom Story 13 years ago, and it was really born out of a passion to see what prevention in the trafficking space could look like, and a belief that it was possible, especially in a time where so much of the narratives, the stories, and the efforts of organizations were focused on rescue and aftercare. And so we really were at that time exploring, what does prevention look like? Is it possible? And how do we measure it? And so 13 years later, we've learned a lot, made a lot of mistakes as well along the journey, but I'm thrilled to be here with Lucy and Veerawit. Today, I act as the CEO of the Freedom Story, and I also run our family foundation in addition to that. So thank you for being here. Veerawit, do you want to take a moment to introduce yourself as well?
Yeah, thank you, Rachel, for the introductions. So, well, good morning, good afternoon, good evening, everyone. I'm Veerawit. I'm Executive Director of the Freedom Story in Thailand. So really nice to be here and talking to you about the prevention work that we are doing. But what I would like to say maybe a little bit about my background. So I have been working over 20 years in human rights field in Thailand, Southeast Asia, and also in the international environment. I used to work with the United Nations High Commissioner for Refugees at the regional office, and also in the border areas between Thailand and Burma for about 10 years. After that, I moved to the US organizations, working on the migration policy under the Obama administrations with the US government, and then found the organizations working on the statelessness, refugees in the Southeast Asia. Apart from that, I have been advisors to the National Human Rights Commission of Thailand as the human rights expert for 2 terms, and have been sitting in a number of committee and commission in the Thai government, working with the civil society in the regions on refugee, migration, trafficking, and representing the civil society in the UN meeting in Geneva also. That's a little bit about myself before I joined the Freedom Story, and then working with the Freedom Story for about 3 years now. So really, very nice to meet you, all of you, and yeah, looking forward to share our experience with everyone.
Thank you, Veerawit.
That's great. I'll go ahead and hop in. I'm Lucy. I have been working with the Freedom Story for about 4 years. Prior to working with Freedom Story, I was living in Chiang Mai in northern Thailand, working with an anti-trafficking organization that focused on helping kids at that office, helping kids that were dealing with being victims of sexual abuse, as well as people who did not have citizenship, people who were stateless. And I worked there for a few years, and I had really been caught up in the narrative of, rescue and aftercare, and that was what anti-trafficking was. I heard about trafficking as a teenager and got really caught up in that kind of narrative, and had never stopped really to consider how trafficking might be prevented, and what could be done to prevent trafficking, and whether that was even possible. I think at that time I was very much kind of believing that, people were picked up off the street and it was kind of random, and there was no way you could kind of predict or really intervene to prevent trafficking. But the more time that I spent actually in the field, I realized that there are so many people who are at risk of trafficking, and they really require holistic, multifaceted support in order to overcome that risk, because there's so many things that can put somebody at risk. And that was kind of how I found Freedom Story. So been working with Freedom Story for about 4 years, working on how to measure our programs, how to ensure that we're being effective and efficient, how to ensure that we're reaching the right populations. Before I moved over to Thailand, I got a master's degree in international development from the London School of Economics. And that really focused on social research and M&E, and how do you capture complex social change that's happening in the community. And so I was able to bring that academic experience and combine it with, the realities of being on the ground, and how do you make that academic work really fit with, the day-to-day reality of working with people. And so that's kind of what I've done for the last 4 years.
Thank you, Lucy. Thank you, Veerawit. So I'll be moderating today's conversation so that we can hear more from both Lucy and Veerawit. And I just wanted to start with a simple question of, what does prevention mean to you? I think we hear that word a lot in this space, and it can mean a lot of different things to different people, depending on your programs or your context or the culture that you're working in. And so I'd love to hear from each of you. Can you share a bit about what prevention means to you? Lucy, let's start with you.
Yeah. I think for me, there's a lot of people who might think about prevention and think about going into a village and doing, you organize an awareness raising event where you tell people what trafficking is, and then you've raised awareness, and so then you've prevented them from being trafficked, and then you get to leave. I couldn't disagree more with that kind of vision of prevention. I think for me, prevention is really about taking people from a place of vulnerability and giving them opportunities to build skills, learn new things, perhaps access to empowerment and things like that. And then they are in a place, they're then moved to a place where they're no longer vulnerable, and they're really in a place of strength. And they're able then to become kind of mentors and leaders in their own community. And that's definitely something that we've seen with Freedom Story. And so that's really what prevention means to me. It's like opening up of opportunities for people who perhaps are not able to access those opportunities on their own.
Thanks, Lucy. Yeah, I think that's just really well said already. So maybe just like to add in, I think to give everyone the example, we are now living in the world of COVID-19, right? When we're talking about prevention, I think it's the action that taken to decrease the chance of getting the disease like the COVID-19 or the conditions that is. So I think it's the same analogies that's what we applied in the preventing of human trafficking as well. So I think what we do in prevention is those actions that can reduce the risk factors that will contribute to people being trafficked. And the other thing is that we do is to increase the protective factors that would protect them from being trafficked. So I think we can talk more about that, but I think this is like the two-pronged approach that we take to the prevention. Yeah.
I can just piggyback on the COVID thing. I've been thinking about this a lot in the last year, how we were all engaged in preventing COVID in the spring of last year, staying home, wearing masks, and now people are getting vaccinated. But nobody will ever know how many people you directly prevented from getting COVID because of those actions that you took. And I think that that's also very apt for prevention. Nobody is really going to be able to prove that there's no counterfactual for prevention, right? You can't prove this person 100% would have gotten COVID or would have been trafficked had it not been for the actions that I took. And so I think it's very easy for prevention to be discounted because there's no, people don't see that direct impact as clearly, or they haven't in the past. And I think we'll get into talking about impact later, but I just wanted to talk about that. Yeah.
Yeah, I'm glad that you jumped in there. Go ahead, Veerawit.
No, I think that's really valid point. I think maybe one of the angle that we can look at the analogy of the COVID-19 is that people are interested in getting prevented from getting COVID more than to be killed from COVID, right? I think that is something maybe not really obvious when we talk about human trafficking, because when we talk about human trafficking, there are a lot of attentions on the survivor of human trafficking and the protections and the rescue that happened, which is great. I mean, that's important, must be done. But when we are talking about prevention of human trafficking, it's kind of like a long shot. That is something that we are doing now that may have the effect in years later. Or, I mean, to be successful, it means that nothing will happen. And that is actually even difficult to explain, more difficult to explain. But I think in the COVID situation, I think this has become like really obvious for people that, I mean, we want to be vaccinated, we want to be protected, we want to not to get the COVID. And I think that is something that we have to maybe apply in the work of preventing human trafficking. That how can we actually vaccinate students and families and communities so that they have immune system against human trafficking. And I think that is also, I mean, and how we can work in these areas even more. Yeah.
Thank you both. I think this is a good lead in actually to the next question that I was thinking about, which is that whether you're talking about prevention through education, prevention through community-based models, you both have just used kind of this analogy of preventing COVID. All of that I think can often mirror what would be considered just general development work. And so what are the indicators, and I think Lucy, you'll have a lot to say to this, but what are the indicators that you've identified that prove the programs are specifically targeting those that are at risk of trafficking and exploitation?
Yeah, great question. You know, the reality is a lot of prevention does look like development work. So the 3 programs that Freedom Story runs are an education program to keep kids in school, mentorship to provide support to them, human rights programming that raises awareness of rights and helps people access those rights at the government level, and then a sustainable livelihoods program to generate income. And these are really based around what we as Freedom Story have identified as the 3 main things that put kids in the communities that we work in at risk of trafficking. So those are poverty, which causes children to drop out of school, which means that they don't have as many opportunities to go and find sort of dignified work or work that can honestly make enough money for them to support their families or to help to support their families. And then the third thing on top of all of that is social isolation, social marginalization, that really compounds those other 2 things to cause kids to drop out of school more or make it even more difficult for them to access, well-paid jobs in the workforce. And so things like being stateless or not having citizenship, lacking documentation, being an ethnic minority group, even things like family breakdown, parents passing away, or, things like health status, family history of trafficking or working in sex work is also something that we look at. So those are the factors that we have found for our context put people at risk of trafficking. So with those 3 programs, we're really addressing all of these factors. So you could argue that this is very close to a development program, but what we do for our indicators and how we measure our programs or kind of evaluate our programs is we look at not only the fact, has a child been prevented from trafficking, like Veerawit said, like at the end of the day, you're proving that something did not happen, right? You're proving the child was not trafficked. But we also look at what are the other positive outcomes that the program has that together we can show decrease these vulnerabilities. So we look at things like, are we able to generate impact or income, through our sustainable development program? Are we able to increase awareness not only of what trafficking is, because a lot of research shows that people know what trafficking is. It's that they feel they have no choice for meaningful or work essentially that will bring them in enough income. So it's not just that they don't know what trafficking is and that's why they end up trafficked. It's that perhaps they don't know what puts them or their children or their community at a higher risk of trafficking. So have we raised awareness of those factors as well? Have we helped people who are vulnerable or who are in situations perhaps where they're being exploited access their rights at the government level, and how many people and how much? And then the education piece, obviously looking at, how many children we are keeping in school, how many of those children drop out of school, but also looking at sort of those Social marginalization factors. Are children less lonely? Do they have a stronger support network? Are they, what are their family relationships like after a year of working with us? Have they become more supportive or less supportive? Does the child feel they have someone to turn to? Our mentorship and what we do with that is a huge part of the work that we do, because we find that these children feel that they have nobody they can talk to. And so when they're approached with a job or they're approached online, as we're seeing more and more, they don't feel that they have someone they can talk to and ask, like, is this a good idea? Should I trust this person? Perhaps they don't even have somebody asking them, who are you talking to when you're on your phone and things like that. But we have found that when we develop that trust with them, they will come to us before those situations of exploitation happen. And we're able to give advice and suggestions that can guide them into the right path.
Yeah, I think along that line, I think general development works is important, is create the enabling environments where we can work in anti-human trafficking work. And I mean, having said that, I mean, what we can see is that if we look at human trafficking, and somebody said that, I mean, if we want to focus on preventing human trafficking, we can just solve the poverty issues. So if people are not poor, then they will not be at risk of human trafficking. But I'm sorry to say that that has been proven not true, because we have people who are from well-to-do families, so they are doing well, but they still become a victim of human trafficking. And that is because, I mean, the lack of knowledge about human trafficking, and also how they would be able to identify the risks that they would be involved themselves into. And the fact that, I mean, human trafficking is now more prevalent, and it can get to them very easily. And it's not just the fact that the economic status of anyone that would have the only factor that matter, but there are a combination of them. And I think that general development work will complement what we are doing on preventing human trafficking. And that is why, as Lucy said, that, I mean, the program at the Freedom Story that we focus on preventing human trafficking derive from the theory of change that we have, that education is the key, that the human rights knowledge is the key, and also sustainable livelihood. So I think if we look at the general developments, that what we're also working on, which is a sustainable livelihood, but at the same time, we're also looking at the education, mentorships, deep relationship that we have between our staff, the mentor, and the students, and the human rights knowledge, and also, I mean, human trafficking knowledge that we share with the students, with the family, with the community, so that we can create this kind of like holistic approach to prevention.
Thank you. You've touched a lot on the programs that are offered, and I would love it if we could go a little bit deeper into that. And so could either of you share a little bit more about what are the programs that are offered today, and how have those changed over time? How have we evolved and learned and adapted to both our learned knowledge, but then also to the changing of the times?
Okay, so Lucy, would you like to do that, and then I can add in?
Sure, yeah. So Freedom Story really began with the theory, as Veerawit said, that education was going to open up opportunity for children that were at risk of trafficking. When we opened 13 years ago, there was a high dropout rate in Northern Thailand. Northern Thailand continues to have a higher dropout rate than the rest of Thailand. And children were not able to access, education at a higher level because their family couldn't afford the extra costs to keep them in school. So we began with providing scholarships for children. That is me, I'm sorry. We began with providing scholarships for children to keep them in school. And then we saw that it wasn't just economic need, it was to keep kids in school. It was relationships. The children missed out on, like I'm saying, having a trusting adult who they can turn to, and a reliable adult, because of family breakdown, because of family abuse, because of substance abuse. They were just missing out on those reliable adult relationships that places like the Harvard School or the Harvard Center for the Developing Child show that that is really the key to what develops resilience in children, is having a trusting adult relationship who can mentor them. So that's, we began doing mentorship as part of what we were doing. And underneath that, there's things like family strengthening. When I talk to the families that we work with, that's one of the things that they mention most consistently is things like our family camp, helping to facilitate, positive communication, positive discipline and reinforcement between parents and children. And then from there, we began to see that, people lacked access to their rights. They weren't documented in the right way. They were missing out on government support. They were not aware of the rights they had access to, not aware, as Vera was saying, of what their own risk of trafficking was. In some places, maybe they didn't know what trafficking was, or they might know, oh, it's this sort of, people go to Bangkok and, but it seems very far away and it's not really related to me. And I can't see how I would be at risk of something like that happening. So opening up people's knowledge around, what are your rights? What are the things that put people at risk? How might you and your family be at risk? What is trafficking? All of those things. And then adding on this sustainable livelihoods piece, where we work with families at the household level to develop plans that can help them create supplemental sources of income. So that's often through things like small scale agriculture, permaculture, raising livestock, that allows them to have an extra income, because often people's income is unstable, either because they're engaged in agriculture and they receive an annual payment for that, and market prices fluctuate, or perhaps they're a daily wage laborer and there's no guarantee today that you would have work tomorrow. So bringing in supplemental income really helps people to kind of increase their safety net, which allows them to stay in school and allows them to keep their kids in school, With that, we also help people understand how to do basic accounting. We help them, walk them through, setting up things like a savings plan. When we talk to families in the community we work with, almost none of them are able to save any money at all. So when their children move up to a new level of education, or they have a emergency expense, there's just no money to cover things like that, keeping them in this constant cycle of poverty that they're not able to escape, and that their children are not able to kind of progress to have a better job because they're not able to stay in school any longer. As time has gone by, we've seen an increase even before COVID of things like online sexual exploitation. And so we began to address that, especially through things like mentorship and awareness, raising awareness of what it is. If you were in the session yesterday about the COVID research, you saw that, these parents that we work with really don't understand technology very well. They grew up in a very different time, and so they don't understand how technology works and how it might put their children at risk of exploitation. And they are not really monitoring what their children are doing. And so there are people who are taking advantage, obviously, of vulnerable children and to exploit them. And so we're working on preventing that from happening as well through, as I said, mentorship and awareness raising. And then in the last few years, we've also begun working with migrant workers from Burma, seeing that, Thailand is obviously a place that many people want to migrate to for work, and that this is a group of people that are very vulnerable to exploitation and trafficking. And so we do awareness raising around what their rights are, the Thai labor law, and specifically around what their rights with the government are, what your right to social welfare is, and also helping them to apply for those rights at the government level with our amazing network of migrant volunteers. So that's a little bit of kind of how things have changed over time. I think with prevention, it's really important to stay on top of how trafficking is changing, and how you can kind of adjust and pivot your programs to meet the ongoing current need.
Yeah, I think that's excellent, Lucy. I think if we're looking back, as Lucy mentioned, that the program on prevention expand. And I think this is when I talked to Rachel in the beginning, that is how we see like the Freedom Story as a startup, right? And we start from something small, and then we grow bigger, and then we scale up. And the program on preventions, I think we expand both the width and also the depth of our programs. In in addition to keeping children in the schools, so we are now looking at how we can improve the soft skill of the students. How can they be thinking about their futures that's beyond their limitations, and how we would be able to work together with the communities to build in the knowledge about anti-human trafficking. And we are also looking at the building the capacities of the families and the community to deal with all of those changes in the human trafficking network. And all of that, I think, contribute to the program that keep on learning and evolving over the times. So in addition to that, I think we also see that we cannot work alone in the prevention. So we need to work with other organizations that are sharing the similar or common concern on the protection of children's rights, women's rights. There are NGOs, CSO that we have been working in Chiang Rai, in Nan, and also in the national and international level. And also, I mean, others, government agencies that we can work together with them because we share the common goal. So I think this is like the tripartite relationships that we have, and also the business sector. So we have also been working with the business sector as well in terms of trying to improve the conditions of their well-being, and also getting them involved in training the student as well. So I think all of this is, I think we are looking at prevention is not just keeping them away from human trafficking, but how can we build their capacity so then they can thrive in the future as well.
Thank you both so much. So we've talked about our programs and how they've changed over time. And I'd like to get a little bit more into kind of the nitty gritty of actually how do we identify who we work with? So how do you identify the children and the families that you work with, and how has that changed over the years?
Yeah, so we use a really robust risk factor analysis to identify the children that are taken in as our scholarship students. Obviously, you know, our budget is limited, every organization's budget is limited, and so we can really only support children that are at the highest risk of trafficking. And so the way that we identify those children is looking at, like I said, those factors that here in Northern Thailand we've identified as what put children at highest risk. So things like poverty, so income per head in the household, so how much income per person in the household, taking into consideration how many people are working, whether that work is consistent, and how many people are unable to work, how many children are in school. We also look at the dedication of the child and the family to education. You know, we are happy to work with children who perhaps are not having the highest GPA in the class, but we do want to work with families that understand that, you know, or at least children who understand that education is important. And we work often to help parents understand that while education has costs and is kind of a delayed gratification, which honestly can be extremely difficult for people who are living in poverty to not only to understand, but to be able to commit to delayed gratification. So we work with them to understand that there's an investment period now, and then later your children will be able to kind of reap those investments in the future. And then we look at things like family history of trafficking, including labor trafficking and sex trafficking, whether there's ongoing trafficking in the community that the child is living in, and what the child and the parents' kind of opinion of trafficking is, or opinion of sex work is, and excuse me, and looking at things like what the family relationships are like, who do they live with, has the child ever experienced sexual abuse, have they ever been exposed to abuse of other kinds, whether directly to them or just at the household level. Those are generally the things that we look at for kind of taking children into the program. Our other programs are open to the wider community. So we do conduct outreaches with villages that have you know, children that are at risk in them. We do work with migrant workers that are at risk as well.
Yeah. Well, I think just like to maybe mention that I think over the years, the Freedom Story developed our screening models. I think maybe you can call it the Freedom Story models on risk assessment. I think our metrics being improved quite a lot in the last few years, thanks to Lucy. And also that I would say that, I mean, our risk assessment models is research-based and evidence-based. So we are really put a lot of investment into the research on what are the factors that contribute to human trafficking. And then we are working it back so then we would be able to identify what are the right metrics that we need to look at in the individual level, in the family level, and in the community level. And out of all those metrics, I think that now we are also working in a more sophisticated level in also giving the weight into all of those factors. And I would say that I think now we are developing our the Freedom Story like algorithms in identifying on who will be likely to be at risk of human trafficking. And that is what we use when we do the interviews. We're looking at the surveys, we're looking at the applications for the students who want to be enrolled in our program, so that it helps us by going through these algorithms that we would be able to identify who are more at risk than the others. And I think this is something that we are really proud of, and I think we would be able to maybe show to other organizations in the future as well.
I would add also that we review those risks every year because we understand that, children change over time, risk might increase or decrease over time. And, we also take into consideration things like behavior. So whether the child is putting themselves at greater risk because of their behavior, and how we might be able to step in and kind of address some of those risky behavior aspects as well.
Thank you, Lucy. That's an important note as well. Can you touch actually on that a little bit and maybe go a little bit deeper for people that are interested in learning more about the risk assessment? What does that process look like as a team each year when you come together to look at the one from the year prior and to open the conversation around what needs to change? What is that process like for you?
Yeah, so when we bring in new scholarship students, we work to coordinate that process with local schools. In Thailand, there are various things. For example, there's a government scheme for children that are in poverty to get a certain amount of money per term from the school. And so the children are kind of registered under that scheme. But obviously, there are also children who fall through the cracks with that. Perhaps they haven't been identified by a teacher or things like that. So we do work with the children that are both in that program, as well as children that we ask teachers to kind of help us to select and kind of screen children to apply. We also work with partner organizations to screen children or to submit children that they feel might be particularly at risk. And so we take those applications and we go and visit them at home. Obviously with COVID, that's really hard, but we go and visit them at home, meet with them, kind of do a due diligence data collection step where we meet with the family, we talk to them, talk to the people around them, talk to the referral organization, gather more data around all of those risk factors and see how the application lines up with those risk factors. And that takes into consideration both qualitative and quantitative data. So we do, under the risk factor evaluation, have a way to kind of rank someone's risk that's quantitative. As Veerawit said, all those factors that I mentioned are actually weighted differently based on how we feel that they put children at risk based on evidence and research. But we also take into consideration qualitative data that's not perhaps captured by the quantitative data. How do you quantitatively measure somebody's relationship with their mom? It's not really possible, but we take that into consideration. And then we discuss it as a team, and we discuss it as a leadership team and try to see how, which students are the ones that are most at risk and work out how we can almost develop, a case or treatment plan for that child. So, are they poor and undocumented? How can we come in to help them generate income in a way that will support their family, even if they don't own their own land? It's very individualized, and the things as Veerawit had mentioned, the programs that we do with children are very deep. So working with individual families to address what their particular risks are, because each family and each child is going to be different.
Yes, and I think over the years we I think developing more rigorous process in this as we are experiencing I think more applications that coming in each year. So I think that's also help us to be able to test the research that we have been conducting in terms of the risks that we can be identified through this process. And as Lucy mentioned, that this process that we have been doing, we also go to our Thai boards who comprise of different areas of expertise. So then they also help us looking at the applications that have been reviewed and passed through the process of the screening. So then we would be able to identify those who are most at risk. And also, we have very strong monitoring and evaluations programs that help us to monitor the process as well. That's also help testing whether those children and the families are really at risk and what can we do about them during the years. And at the year end, we also have the review of the students and the families every year to see where they are in this metrics. And then we can make assessment based on that. And I think that also help us because we will be able to be very objective about our programs, our involvement, and then also to see that, I mean, if some of the students and the families really make good progress, and then we would be able to quantify in how they would be able to graduate from our program. And I think it's also a very good point that may not be they may not be needed to be in our program forever. There's an ending point that they can graduate from our program, that they are strong enough, that they are confident enough, that they would no longer be at risk of human trafficking. So I think that's also a very big point of, I think, celebration for us and for the family as well.
I should say, like, all of those things, like you were saying, Veerawit, all these things that we do with the families are really co-developed with the child and the family. You know, it's not just Freedom Story coming in and saying, you need this and you need that. We work with the child to identify with them, like, what are the goals that you have for yourself over the next year? What are the resources or the skills that you would like to access or develop? In our center in Non, we had a student, for example, who the place we work in Non is extremely remote. So it's about an hour and a half from the nearest 7-Eleven. And so the student wanted to learn barista skills. She wanted to learn how to make coffee and be able to kind of develop those skills for perhaps potential supplemental income in the future. Now, there was nowhere in this village that she was going to be able to do that. But actually one of our partners, CP, which is a big corporation here in Thailand, built a cafe, and we were able to work with them to advocate for her to get kind of an internship or like an apprenticeship at the cafe so she could learn those skills. So it's not just, you know, Freedom Story coming in and telling everybody what they need, but it's working with the families to identify together what they need and how they would like to take steps together to kind of address those risks.
Thank you both so much. And I know that this is still skimming the surface on a lot of things, but I did want to make sure that we had time for Q&A. And so if you are interested in asking a question, I am monitoring both three things: the chat, the Q&A through Zoom, as well as Whova. And so please feel free to submit a question through any of those three platforms, and I will do my very best to answer as many as possible with Lucy and Veerawit in the next 20, maybe 25 minutes. So to start, what are some of the challenges in prevention during this global pandemic that we are experiencing? Veerawit, do you want to take that one?
Yeah, the COVID situations really put us back. I mean, in terms of the effort that have been putting into the anti-human trafficking work and also the prevention work, because of many families lost their income. Some of the students who managed to study and then working part-time, love the part-time work. And also the general situations has been quite depressing and making the families in really difficult situations. And if you're looking at the migrant populations, the migrant workers whom we are also working with, they are also being hit really hard because of the COVID. They have been locked out, they lost their job, and they have not been paid for the work that they have already been doing. So all of that create these vulnerable situations that we need to work even harder in the COVID situation. And by being lack of adequate support from the government in all of the protections like masks, hand gels, or other form of the protective measures that can protect them against COVID. That's also something that we have been working on to provide the support to them as well. On top of that, when they are at these desperate situations, they have been approached by the human trafficker to trying to go to work somewhere. And then when we learn about that, because they inform us, because that's something that they learn from the training, that if something suspicious came up, then they can inform us. There's also another way to prove that the prevention work. And then through our interventions, we managed to weed out those human traffickers who have been trying to approach our populations. And also for the students, I mean, as the schools are closed, so they have been staying at home during the lockdown, so they have been studying online and then going online even more. So there have been, I think, attempt to by the human trafficker to talk to them and then trying to convince them to do some sexual acts or going somewhere. And again, it has been proven that our prevention models work because they inform us about all of those, and then we could intervene timely in those situations. And yeah, fortunately, nothing happened as a result of that. So we can see that, I mean, the situation is getting worse, but that also means that we have to work harder as well.
Lucy, did you want to add anything to that before I go on to the next question?
No, I think, we really see vulnerability is increasing as a result of COVID. Obviously, having to be online is a huge challenge as well. Our research that we did showed very clearly that people are not able to access online education and online learning. And so it's really important. I think what we've done is just really continue to phone people and talk to people regularly on the phone, check in with the students and the parents when we're not able to visit in person. When we are able to at least go and visit in person, perhaps socially distanced and wearing masks, that's even better as well.
Thank you both so much. I also did want to mention that if you are utilizing one of the translation services today, please feel free to submit a question in your language. Our interpreters would also be happy to interpret that for you, so we can get questions answered from everyone. So the next question that came in, Lucy, I'm going to direct this at you. And they said, Veerawit mentioned about children graduating from the program, which is great, right? That's one of our success indicators is children graduating from the program. But what are the indicators to say that a child is no longer in need of the program?
Great question. So that risk factor analysis that we've been talking about, we have, like I said, a way for us to quantify the risk that a child has at that time. So we have that broken up into colors based on, the urgency of the case at that particular time. So when we find that a child has moved from red or orange or yellow down to being green, i.e. they have less risk, that is the point at which we talk about potentially helping them to graduate from the program. So what does that decreased risk often look like? It looks like changes in behavior. So where they might have previously been engaging in risky online behavior, sending photos or sending videos or discussions with strangers, we see that decreasing, for example. It also means things like increases or changes in family financial situations that would allow the family to continue to support the child to stay in education. It could mean changes in legal status, a child being able to secure citizenship or legal status that allows them to access government benefits that can help them to keep themselves in school. And it also means, changes in attitudes, perhaps where we had previously seen, for example, families in our program that, have strong beliefs around not needing to educate girls as much as boys because there's not as much, benefit for the family financially as the girl is going to go off and get married to somebody else and join their family. Changes in those attitudes so that we know that, even if we stopped supporting them financially, that they would be able to and be willing to continue to support the child. Now, with that, we do continue to mentor and follow up with children who have graduated from the program, but and so that we can keep track of kind of how they're doing over time. And of course, if their risk situation changes in the future, we would, open up the opportunity for them to rejoin the program at that stage.
Thank you. And Veerawit, I think this next question is great for you, as I know that your focus has been much more high level in the fight against trafficking. And so it's in addition to addressing the individual and family risk factors that we've talked a lot about today, do you also address the systemic level factors such as laws, policies, and economics, either ourselves or in partnership with others?
Yes, that's also really important in order to have effective protection programs, because as I mentioned earlier, that we cannot work alone. I mean, we have to work together with the government and the Thai government agencies who are concerned about human trafficking. I mean, the police, the lawmaker, the policy maker, and different ministries that need to be involved. So we have been working together with all those ministries in the provincial level and also in the national level, by bringing in the experience we found on the ground on the real situation that happened, and bringing into the discussion in the policy level to see what needs to be done, where are the gaps, and how we can fill in those gaps. So we are working in coordination with other civil society organizations and in partnership with the government agencies. So we have been able to identify those areas that we can work together with the government to enforce the law and the regulations, like in the tourism industry. So we have been working with the coalition of NGOs and then working with the government up to the highest level, the Deputy Prime Minister. And then we are looking at how we would be able to work with the hotels, businesses to do the training for them, and then to build the capacities, and then creating the kind of like the warning system if there's any suspicions of being human trafficking that's going to happen in the hotel or business premises. So, I mean, that is for some example, but there are also others policies that we have been working together with the government agencies on other issues related to labor trafficking and also exploitation of children, and also together with the Thai CAC, the Internet Crime Police as well, cracking down on all those who are preying on children online. So yes, a number of efforts that need to happen, not just in the local level, but also in the national level. Yeah.
Thank you, Veerawit. I'm going to open up this question to both of you because I think it's a big one. And it's, what are the benefits and dangers of residential care of children as prevention? Lucy, I know you've done some work with Step Ahead and the Quinleys. Veerawit, obviously you have a lot of experience with this as well. And so I'll just open it up to both of you and whoever would like to take it first.
Yeah, it's a great question. There are quite a few prevention programs that utilize residential care. So the benefits of that are, I don't want to be like glib. The benefits of that are you have almost total control over the child. If they're living with you 24/7, you have control over like where they're going and what they're doing, especially in their free time after school and weekends. And so it's in that way, I think, quite easy to continue their education and to provide things like supplemental education. I often, with our Thai staff, to be honest, talk about the fact that if we did have a residential home, in that sense, some things would be easier because the children would be with us 24/7. We wouldn't be having to work to mitigate for some of our families, families, some of the influences that the families have on the child that might not be beneficial to the child or to their education. So I would say that's one of the benefits for prevention. However, on a scale, I would say there's a great many more negatives for residential care. In general, research shows that children who leave residential care or graduate out of residential care have much higher rates of history of abuse. They are much more at risk of trafficking, often because they're not effectively or not well prepared to really enter the real world, so to speak. They're not really set up for the workforce because often they've had everything done for them in the care home. And they often struggle to adjust, not everybody obviously, but there's many negatives to residential care in general. If people are looking to learn more about that, you can check out Alternative Care Thailand, or Lumos is a great organization working on residential, ending deinstitutionalization, or working on deinstitutionalization. However, yeah, I would say, and I think on a wider scale for the people who, or the groups that are having children at risk live in residential care, you're also not really solving the problem in the community, because you're removing the at-risk child from the community and from their family. And so the sort of root causes of those problems, poverty, and the social marginalization problems that we talk about, are not really being addressed in the community. That would be my other point of feedback on residential care homes and prevention.
Yes. First of all, I have respect to those who run residential care. They are doing great jobs in supporting the children in need. Having said that, to me personally, I see residential care as a short-term solution. This is something temporarily that needs to happen. But when short-term becoming permanent or long-term, I think that is where the problems begins. And as Lucy mentioned that, the research will show that children in the facilities have the tendency of being abused and more likely to be victim of human trafficking. And I think that is where we are concerned. And I think that is what the reasons behind the Freedom Story, that we base our model of being with the children, being with the family, because we believe that the families and the communities are the best places where the children can grow and develop. And like like the saying in Africa, right? You take the whole village to raise a child. So, and we believe in that as well. So the child should not be isolated and then being nurtured in the enclosed environment. But I think if the child is in the family, and we can work with the family and the community, I think that's more sustainable, and it's not to isolate the problem, but we take the problem to the communities and then we work on it together with the community and the family.
Thank you both. I think that was really articulately said. This next question I really appreciate also for its articulateness, and I'm going to read the whole thing. Stick with me, it's a little bit long. It starts with, I like the analogy of preventing COVID. However, in the case of COVID, the virus is largely beyond our direct control. We cannot make the coronavirus act any differently. Great point. But in the context of trafficking, that doesn't fully apply to traffickers. Unlike a virus, traffickers can be encouraged to change in positive ways. What opportunities do you see in changing traffickers' behaviors as a form of prevention? And what interventions might prevent people from becoming traffickers? Lucy, do you want to start with that?
Sure. There's also a question in the Q&A very similarly about traffickers and how we might be able to prevent traffickers. So I'm really excited to be answering this question. Great point about COVID. I think we were talking more about the incentivization of staying home and how a lot of people don't clearly see the link between prevention and their impact, or people are not incentivized to work in prevention because, as Veerawit has pointed out, you're proving that nothing happened. So For me, in the context that we work in, there's two things to do with traffickers. The first one is that I believe, and if you actually check out the Blue Dragon in Vietnam has put out a great report on this, that the things that put people at risk of trafficking are also often the things that put people at risk of being a trafficker. So poverty, low levels of education, lack of economic choice, those are all things that put people at risk of becoming a trafficker because it becomes the opportunity for them to make money that they feel like they don't have any other opportunities. I would also say in the communities we work in where there's active trafficking happening, it's often people who have been trafficked themselves that go on to traffic other people. And so we do work with those families and in those communities to help to address those the risks in the communities and the risks in those households so that those people are incentivized to act differently and the children that they might be looking to traffic have other opportunities, even children within their own families at certain times. So we do actually work with traffickers in that sense to overcome the risk of trafficking in their own community. But in general, I would say that the things that make someone a victim of trafficking or more likely to become a victim of trafficking are also the things that are going to make someone more likely to be a trafficker.
Yes. And I think, if we want to work with the human trafficker or those who have the potential of becoming one, I think the risk is that we will be casting the net very wide in trying to reach out to them as well. And I think in terms of prioritizing resources, I think if we would be able to work with those who are likely or have the potential or at risk of becoming the victim, then I think that is where we can direct our focus to that particular group of populations better. But at the same time, as mentioned earlier, is that we did not neglect on reducing the environment where the human trafficker will be operating. That is why we are all working together with the authorities in addressing those gaps and then trying to create an environment where the human trafficker will be really difficult to operate. And that will reduce the likelihood that the human trafficker would be able to exploit on the students and the family. And I think when we are working in these areas, what we learn from the communities, as Lucy mentions, that human traffickers are usually from the same communities and they have been trafficked before. And as a result of that, now they are looking to recruiting students to be trafficked just like them as well. So by working with the community, I think this is a very important point that we mentioned before, that the community would become aware of these risks and they work as the community to prevent that from happening. So the human trafficking would not have the environment that they would be able to come in, inviting students, talking to the families and giving those false promises. That cannot happen because we work with the community. And I think that is the way that we work as a prevention, that we decrease the likelihood that something that nature could happen. Yeah.
Thank you. So we're nearing the end. I think we probably have time for about 2 more questions. And so I apologize if we weren't able to get to yours. I think we maybe tackled about, gosh, if even 1/4 of the questions that were submitted. So second to last question was, how are prevention activities done in our community, which I think we have addressed pretty thoroughly for a 1-hour conference call. But then the follow-up to that was, is giving non-formal education for children that drop out of school also an effective way to offer education as part of your prevention program? So Veerawit, could you maybe start by explaining a little bit about what non-formal education is and then speak to its effectiveness?
Sure, yeah. I think the focus has been the formal education that we put students in schools, that is studies to high school or going to the university level. But the non-formal educations that we have been working could be the vocational training that they study at home or other facilities, or the distance learning that they can also do as well. So I think that is something that we also expand our program from formal education to non-formal education over the years. We have students who are interested in having the careers in, like Lucy mentioned earlier, like barista or being chef, being a pastry chef. And in the past, if we really want to like support them or providing scholarships, then we only look at the formal education. But now we can see that, I mean, if they will be able to develop a careers based on what they would be learning, that's also the Freedom Story can support them as well. And some of the students, they need to work. I mean, those who are like, I mean, about the age of working, then they can do the non-formal education at the same time of maybe doing some part-time works that we also help monitoring the working conditions that is not abusive to the students. And that's something that they can do together as the studies and working and earning income. So I think those are the possibilities that we have been looking at. So Lucy?
Yeah, it's a really great point. You know, it's not just academic success that's going to set children up for success in the future. Not all of our children are interested or fully equipped for pure academic success. So we do all of those vocational skill trainings, like Veerawit said, and do support children for non-formal education. Thailand has a great system where people can get, you know, certificates and government recognized diplomas for things that are non-formal education as well. And we also work on developing soft skills and life skills with our students that would allow them to enter any kind of workforce in a way that, you know, better prepares them for that. So, you know, the great thing about prevention is you're not only preventing trafficking, that's almost the baseline. It allows space for you to build up these children to allow them to thrive.
Great, thank you. And I think I'm going to save potentially the hardest question for last. And I would love for both of you to share your thoughts, because I think that this is something that we wrestle with quite a bit as an organization. And that's simply, how do you ensure the prevention of dependency on the organization amongst our programs for our students and the communities that we work with?
I think that is a really good question. And I think this is something we have been trying over the years to overcome that dependencies. I think that's the focus of our Sustainable Livelihood program. I think we grow from being the organizations that we provide a scholarship, we provide a support, providing grants to the family, to how can we build their capacity so that they will be able to stand on their own feet. And that is, I think, the goal of our Sustainable Livelihood programs. Because if they would be able to generate income that is sufficient for them to take care of the family, then it would be less likely that they will have to depend on the organizations on prevention. And I mean, to be brief about that, our Sustainable Livelihood is now evolving, and then we are working like being like angel investor. So we do the training to the family, so then they learn about new career, new job opportunities, new business, and become they can become the entrepreneur. So we also provide seed funding, like providing like a sandbox to test their ideas. If their ideas works, then they can help them scale up. So we are also incubating them in what they want to do. We have the children in our program who attend one of the trainings about becoming the entrepreneurs, and he was interested to raise a pig. And we did. We support him to do that. So that is also to give you some of the example, but I don't think we have time to go into detail on that. But we really looking forward to the model that's not creating a dependency on the organization.
Yeah, I think all of what Veerawit said is so true. And when you're thinking about, you know, dependency, it's very easy for whether you're prevention or aftercare, any kind of organization, to set people up, I assume, unintentionally to be dependent on your programs. And so we work really intentionally to ensure that families know that the support we're offering is not forever. Should their children no longer be at risk, then we will support them to support their own children. And that's often financially through that Sustainable Livelihoods program. And we are also working, with entire communities to overcome their risk as well, so that they're not dependent on us, so that they can learn how to do sustainable livelihoods, or learn how to submit their cases at the government level for their rights themselves, rather than always having to kind of pass us or always having to come to us first. We also work to build up, the life skills and the soft skills that help families to solve their own problems, or sort of learn how to depend on themselves and not purely depend on Freedom Story. And I think that can be very difficult for any organization. It can involve quite a lot of being, analytical in your evaluation of somebody's situation and whether or not they truly need extra support at the time at which they might come and ask for it, for example. We do have, of course, avenues for children and for families to access things like emergency funding and emergency support, but we have set up pretty strict criteria for those situations that would, limit the potential for someone to become dependent on us as their main source of income or their only source of support.
Great. Well, thank you both so much for your wisdom, for your hard work, for your passion in prevention. And I am so grateful that we were all able to learn from and with you today. If you are interested in learning more, or perhaps we didn't get to your question, there's two avenues in which we'd love to continue the dialogue. The first is through the, it's one of the community chats that Veerawit started about prevention. And so feel free to engage with any of us within that chat through the Whova app. And secondly is that you can reach out to us directly through our website or through our email. It's contact@thefreedomstory.org. We will respond to you, and we'd love to share our experiences, knowledge, wisdom, as well as answer any questions that you have. If you are also working in prevention, we'd love to know about you. We know that there's not a whole lot of prevention organizations out there, and so we would love to be able to support one another as much as possible in this journey. So please do reach out to us. Thank you so much to Eric for hosting. And Joe, I can either conclude or turn it over to you. Just let me know what you'd like.